knee arthritis problem which can cause a very painful joint. Patient is very disabled with the pain and the mobility. Now this is your normal knee joint, where you can see the surface of the joint is very smooth and this joint is completely lubricated, provides a good pain relief and the function to the knee joint. But when there is a degenerative process sets in, or this cartilage surface of the joint gets worn out completely and knee becomes very painful. Naturally, at the end stage of disabling arthritis, the only solution is a knee replacement surgery. Now what happens in knee replacement surgery? So the degenerated part, which is the surface called as a cartilage, is being replaced by a very highly polished metal alloy implant or prosthesis, which is called a knee replacement prosthesis. Now these parts of the joint is being fit in by shaping and cutting a bone in a perfect manner in a conventional way by instrumentation sets which has been provided by different companies. Now when you cut the bone and put these joints inside with the help of bone cement, here you see they have to be placed very accurately and perfectly, and the knee becomes completely straight and the functions are in a stable dynamic situation. But why we are talking about a technology today? What happens in the technology, that whatever God-given joint is given here, if you see here, all the components are placed in a 6 dimensions in a different position. That accuracy has to be matched when you need to have a very accurate and precise surgery. So in Hiranandani hospital, we have launched a robotic knee system. Though we were doing a computer navigation for last 18 years, but there is an excellent advantage of a robotic knee replacement system where these joints can be placed really accurately and very precisely by using a robotic arm. Now, when you put these joints accurately and precisely, long-term results are going to be much, much better. Definitely, you can put also these joints within a small incision, which is called as a minimally invasive surgery. In that case, the pain factor can be controlled in a much better way and the person can have less pain while recovering through the process. Third, another advantage of this particular surgery is that these joints can be accurately not only placed, but you can also have a better placement of this implant in 3 dimensions, what is called as a 6 dimension or freedom, where these implants are placed in all planes, sagittal, coronal and other planes, in a perfect position. Now finally, this process can be customized during the surgery, where you can have choices of changing the sizes or position as per the need on the table. Of course, you have all these kind of components during the surgery. The recovery is very fast, pain is pretty less and person feel very natural. So there is definitely a huge advantage of robotic knee replacement surgery or robotic system using in a knee replacement surgery for a very accurate, precise function. Of course, a better pain management, and of course, at the same time, you can say at the very fastest recovery.